So good morning. My name's Dr. Stephen Jeffries, and I'm going to be giving a short talk about pain and how pain is somehow like a guitar. So here's a picture of a guitar and an amplifier. And you'll see that the guitar is connected to the amplifier by a wire. And the guitar can be strummed, and the message from the guitar travels to the amplifier, and the amplifier can be turned up or can be turned down. And now we'll look at a knee. The connection will become clear. On our left, we have a picture of a normal knee. You may have seen x-rays before. The gap between the femur, which is the top bone, and the tibia is fairly wide, and that represents a normal-looking knee. There's quite a lot of cartilage in there. This is probably not a painful knee. On the right, figure 2, we have a picture of a knee with arthritis. And you'll see that the gap between the femur and the tibia is much smaller. And in fact, the bone is rubbing against the bone, and there's even a little bone spur. A little bit of extra bone is appearing. So that looks like a pretty painful knee, doesn't it? So, pain comes from the knee. Or does it? Interestingly, a bad-looking x-ray doesn't always mean a lot of pain. Some people who have an x-ray, like the bad x-ray, have very little pain. And sometimes we're very surprised when someone comes in with a swollen knee and we x-ray it and it looks very badly arthritic, and yet the patient says, it's not that painful. That's kind of odd. And vice versa. Certainly, there can be a lot of pain associated with very normal-looking knees. So there's an interesting paradox there, that we can have a normal-looking x-ray with a lot of pain and a bad-looking x-ray without much pain. When it comes to treating, medications can help, but by the time it gets to very severe arthritis, medications lose their effect. And so we go to surgery, but some of you may have experienced even a new knee joint may not take the pain away. So there's something else happening. It's not just the bad knee that's causing the pain. So let's just look at the knee and the brain as if we're looking at a guitar and an amplifier. So there's our guitar, the bad-looking knee, and it's sending messages via the nerve into our brain. But the brain is doing something interesting. It may interpret those messages as very little pain, or it may interpret them as severe pain. It's all in the brain. The pain is in the brain. So, just like the amplifier, in our brain we have a volume control for the pain. Now, we're all born with a certain setting for that volume control. Some people are born either very stoical, or maybe they just don't feel pain as much as other people. But we're all aware of these people. They seem to walk around, they look disabled, but they're not in pain. So, and that is something partially that you're stuck with when you're born. I worked in Greece for a while. People in Greece seem to express their pain very vividly. And even a small amount of what you might think of as a small amount of pain can produce a lot of distress in those warm Mediterranean countries. So we're born with a certain amount of volume control setting. However, we can change the volume control with many factors. There are many ways of changing that volume control. One thing is certain. The higher the volume control setting, the more pain we have unrelated to the amount of damage in that knee or damage in your intestines or wherever the pain is centered. Doesn't matter how much there is. If the volume control is set low, you won't feel very much pain. How do we turn down the volume control? That's the $1,000 question. Well, there are many ways that we can do this. Some require the help of therapists. Some you can achieve by looking online. Sleep. Sleep is extremely important, and not the kind of sleep that is achieved with medications. Medications are very good in the short term, but in the long term, they disturb sleep. But there are methods of improving your sleep, and in future talks, maybe we'll come back to that. Understand your pain. We have found that the more people understand about how pain is generated, where pain comes from, how it's changed in the brain, the more they're able to control the pain. So the volume control can be turned down if you understand the pain. You can change the way you think about pain. Some people think of pain as the enemy. Some people say, well, maybe it's my friend. It's telling me to pace myself. So there are ways in which you can change the way you think about pain, and while the pain is still there, it's not as distressing. Take control. There are many things you can change in your life that may be helpful. They might be as apparently unrelated as smoking. Actually, smokers generally have more pain. They certainly have more back pain, something that I see very frequently. So take control of your life, change the things that you can. Read a funny story. Now, this sounds a bit obvious, but distraction from pain, such as I'm doing right now, is a very effective way of relieving the distress of pain. So distraction by watching a humorous movie, involving yourself with friends who make you laugh, all these are very therapeutic. Exercise. Well, you may say, how can I possibly exercise when I've got such a bad arthritic knee? Well, there are means of moving. They might involve water. They might involve static cycling. But a lot of these activities crowd the brain with information that drowns out the pain. And so we always recommend some form of activity when we're dealing with pain, patients with severe pain. Call a friend. A pain shared is a pain halved, generally. However, as a rule, if someone with pain is asked how they are, the correct answer should be, I'm feeling fine. Because in fact, you can put off your friends by talking too much about pain, and they will treat you as an invalid, and then you'll think of yourself as an invalid. But nevertheless, human communication is a very powerful tool. Join a group, just about any kind of group. One of the problems with pain is it tends to isolate people. They're not as active, so you can't go out. Maybe you're taking medications that dull the senses. So being in a group, it doesn't have to be a pain group, it could be any kind of group, is also therapeutic, turns down that volume control. De-stress. There are many ways of reducing stress. Some of them are taught. There are breathing activities, there is yoga, and there are many other methods to reduce stress. Stress and pain are very closely allied. And a very effective method of turning down that volume control is to reduce the amount of stress. Some of these factors can be put together. There is a type of therapy called cognitive behavioral therapy, and that will be the subject of further talks, and when we have developed our website, it will be a major thrust on our website. It can take many of the aspects I've talked about, put them together, and teach you methods of controlling pain without medications. So here's our final slide. So you see, pain and the brain are very similar to a guitar and an amplifier. When we had Tom, our guitarist, here earlier, he was playing his guitar very loudly. I thought it was very good. But I simply turned down the amplifier, and now, even though he's twanging away, you can't hear the sound. So in the same way, you can turn down the volume control in your brain and you don't hear the sound of that pain. Thank you very much.